Okay, so class, so far we've talked about the different definitions of delegation, the barriers and the benefits to delegation, the 5 rights to delegation, the different types of delegation, and the scope of practice relating to what can be delegated and to whom. All right, so we've all talked about as new graduate nurses, it can be challenging to delegate. Sometimes you have discussed that you want to be able to do it all yourself, and then sometimes you talked about that you don't even know what to delegate. Okay, so we're going to be able to apply the information that we've learned today, and we're going to participate in a role-playing activity to help practice some of our delegation skills. Okay, and so our objectives and our outcomes that we hope to achieve during this role-playing activity is that you will be able to apply 5 rights of delegation when working with a nursing assistant or other staff, that you will be able to practice the 3 different types of delegation, and that you will be able to utilize the scope of practice guidelines that we just discussed and talked about so that you know what and whom tasks can be delegated to. All right, so in a moment I'm going to invite 2 people to come up and act out our first scenario. And one of you is going to play a new graduate nurse. Maybe you've been out of orientation for a few weeks, and the other person is going to play a nursing assistant, and the nursing assistant and the nurse will have an interaction. That you guys are going to receive a little bit of information about the situation and the patients that you're caring for, and then as the scenario continues on, we might add a little more information and some extra personnel. Okay? So who would like to volunteer? Okay, I'd like to thank Ederlyn and Melissa for graciously volunteering to come up and do our role-playing activity. And as they're coming up, I want to let everyone know that our expectations for the activity are that Ederlyn and Melissa do act as if they were on the shift, and that they interact together in a professional manner, and they speak as if they were working together. And then also I want to challenge Ederlyn to think out loud so that we can understand what she's, how she's making her decisions and her thought processes. So those are 2 things that I'm going to ask of the 2 of you ladies. Also, we're going to be videotaping so that we can use the videotape after for our debriefing as a very important part of this role-playing activity. So any questions before we start? Okay, so I want to give you your scenario and your patients. So Ederlyn, in room 402, you have a 12-year-old boy who is a post-op spinal fusion, 5 days. The patient is on a regular diet, is mobile, he has a wound dressing that's clean, dry, and intact, and he's going to be discharged today. His parents are in the room, and he will be needing some discharge instructions along with some other tasks that I'm going to talk about in a minute. And then you also have a patient in room 405, and this is a 5-year-old girl who has an upper respiratory infection. She did spike a fever at 3 a.m. and cultures were sent, and the initial dose of antibiotics was ordered and should be coming up to pharmacy any minute. And SATs were also dropping, and she had some difficulty breathing, and so now they have her on 2 liters of nasal cannula, and she is satting around 95% and 100%, so that's better. And there is also concern because she last voided at 2 a.m. Okay, so those are your 2 main patients. And then also you will have a patient coming up soon after shift change, after you're going to be getting report, and that's something that will also have to be thought about as you are planning and delegating. Okay, all right, so let's get started. Okay, Ederlyn, so these are the tasks that you have to do once you've received your patient assignment and your report. So can you talk us through which ones you need to do yourself and which ones you can delegate?
So looking at this list, I definitely have to do the physical assessment, the meds, the physical exam, and discharge teaching, while I can delegate the vital signs, the ADLs, and discontinuing the IV.
Okay, great. So let's practice our delegating now.
Hey Melissa.
Hi Ederlyn.
How are you working together today?
Good.
Just a couple of things before we get started. Do you mind checking the vitals on patient in 405 first before the others? I know you have a lot of patients, but do this patient first because I'm really concerned about her. Also, let me know if the patient's temperature is over 38.5 and if the vital signs are abnormal, and definitely come tell me right away. Okay?
Yeah, that's fine. I'll make that a priority.
Okay, thank you. And also, please make sure to let me know about the urine output for this patient, because if there's still no urine by the time you check her, definitely let me know. Let's see what else. When you have time before 11, also, can you please DC the IV in room 402? Have you done that before? You feel comfortable?
Not really.
Okay, no, that's not a problem. So I can come and show you how to do this so you feel competent and confident about it, and you can learn how to do it. So just call me when you're ready, and then once this is done, we can get them discharged. Okay? Do you have any questions for me before?
No.
Okay. All right, thank you so much, and let me know if you need anything at all. Okay?
Okay, so Ederlyn, now you're going to be in the patient's room taking care of the patient, and you're going to get a knock at a door from another nurse asking you something or telling you something, and we'll go from there, okay? Hi, Ederlyn. I just wanted to let you know that the pump in 402 is going off right now, and is there anything you want me to do with it?
Yeah, can you do me a big favor? Do you mind resetting the pump for 2 hours and definitely checking the IV site? We have the code team coming and we're going to be busy in here for a little bit. But let the patient's family know that I'll be there as soon as I'm able to, and to talk to them about the patient.
Okay, thank you. I'll do that right away.
Thank you.
Let me know if you need more help.
Okay, definitely. Thank you.
Okay, so in this scene, you're going to be walking across the unit, and you will encounter a parent, and we'll go from there. All right, ready, go.
Hey, I'm really upset about the situation. I need someone's help right now.
I'm going to have you talk to our charge nurse for the moment. Jessica, do you mind talking to Mrs. Heron right now? I have something going on in the other room, and I want to make sure that she's taken care of, but I do need to go back to the patient room. So do you mind talking to her for a little bit? Thank you.
Okay, thank you, Ederlyn and Melissa and Lauren, for jumping in and being our angry parent. That was a lot of fun, and you guys, Ederlyn especially, a lot of really good practice in delegating. And so now what we're going to do is we're going to watch the video, and we are going to discuss and debrief as a group about situation and how Ederlyn handled delegating to each the nursing assistant, to her nursing colleague, and then delegating up to her charge nurse. And we can talk about, what you think she did great, and then what areas that you think that maybe she could have done a little differently, or maybe she could have been a little bit more specific in her directions, or maybe she did everything really well. So let's roll the video and start debriefing. All right, thank you, ladies.